Welcome to Effective Cannabis Conversations, the show where knowledge meets curiosity and stigma takes a back seat. I'm Debbie Wimberly, your advocate for all things empowering, educating, and elevating in the world for better health. Before we dive in, just a quick reminder, the information we're sharing today is for health awareness only. It is not medical advice or a substitute for consulting your doctor. It is here to help you learn, ask the right questions, and make informed decisions about your health and your care. Welcome to Effective Cannabis Conversations, and we are in for a real treat today. We have two scientists that are joining us that are changing how we think about and talk about cannabis, and I couldn't be more excited. We have Dr. Riley Kirk and Dr. Miyabe Sheilds. You can introduce yourself far better than I can, so I'm going to ask each of you to take a few moments and introduce yourself, please. We'll start with Miyabe.
Sure. Happy to be here. I'm Miyabe. You prefer they, them pronouns, and I have my PhD in pharmaceutical sciences, and I studied the structural biochemistry of endocannabinoid system targets in the brain and body, and specifically was looking at drug discovery for trying to discover new molecules that activate this system or enhance this system in a way that can help with substance use. And the entire time that I was doing my research career in academia, I was thinking about all of the molecules that we have yet to understand in the plant and how little information we put into that. So yeah, really excited to be here and to be talking with you about what we do and don't know. And yeah, I'll hand it over to Dr. Riley Kirk. When we met, I feel like I had a moment where I was like, are we the only two people in drug discovery who are awake? Which is not true. We're not the only two people, but there's a surprisingly small number of people who actually use natural products. And so the two of us and our backgrounds are really complementary. And Riley actually introduced the word pharmacognosy to me. So I'll hand it over to Dr. Riley Kirk, and I'm prompting that you explain pharmacognosy for everyone.
All right, cool. So my name's Dr. Riley Kirk, and my background is in pharmacognosy, which is really the same field as natural product chemistry. Pharmacognosy really breaks down into the knowledge of medicines, because when we were first even understanding that some things could be used as a medicine, our only medicine was plants and fungi and other natural products. So the word pharmacognosy is actually the OG pharmaceutical sciences. It's really where it all started. And 60% of all drugs are still modeled after naturally occurring compounds in some way. So nature is still very integrated into the way that we discover new medicine. But something that myself and Dr. Miyabe Sheilds, I think something we think of a little bit differently is really evaluating the synergies in nature and understanding medicine under this view of synergies and nature working in networks instead of this linear path that we often think of with something like pharmaceutical sciences. So that's really the lens that we want to bring into the research that we're doing, is understanding complex systems, understanding people's lives and the different aspects of people's lives that may affect the way that medicines interact with their bodies, and just kind of understanding people as a whole instead of just like a lab rat, and the ways that people respond to these medicines and use these medicines and the doses people use, because we know that cannabis is an extremely safe medicine. It's been used for such a long time, and we've never really probed the community to ask them, hey, what are we already doing and what's already working, so that we can communicate that back and more people can have a positive experience with cannabis.
Remember when I asked you, do you consume or do you partake? Okay, last mention though is that we both definitely consume, and that, cannabis has shaped this opinion scientifically, and that there's a lot of stigma that's associated with the science of medicine. So really excited to answer some questions for you guys.
Well, and we're going to dive into all of that. And I went through my medical training in the 70s, and there was no discussion about cannabis, marijuana, endocannabinoid system, nothing. So is that still the same for you when you were going through school? Was there still no mention of this?
It was shocking how little mention I think there was until I happened to work in a lab. That was really the first time that I came across that there's this entire system, and it came up in an email in just a position for a drug discovery like research internship. And I was never actually formally taught in a lecture base on the ECS. Even throughout my PhD, I was taught about like the concepts, but even getting my PhD studying the biochemistry of the ECS, I didn't actually have one entire formal course or one entire formal lecture on it. So for me, it was very much the same.
Yeah, same. I was never like properly taught about it. Once I had the tools to do research that I learned in grad school, I nerded out about it, found out about it, you know, really educated myself about it. And then when I was teaching the cannabis certification course at URI, we had a section on it, but that was like a specific cannabis course that I was helping teach, but I was actually never taught it properly.
Right, it's a
Which is kind of
self-learning.
funny. Yeah.
And then we're trying to change that. I mean, that's something
Yeah.
that like very much so. There could be an entire year-long course just on the ECS. I mean, it could be even longer than, and I mean, both of us spent years and years and years nerding out about it.
Oh, I totally agree with you. And I think there should be more courses on this. Right now, we're working to try to figure out what colleges are teaching this knowledge beyond how to be a grow, a dispensary, run a business, make product. How are we teaching people about their ECS, which is your endocannabinoid system, everybody? And how do you know how to engage it yourself? Because this is such a critical piece. And everybody's system is different. And so what works for me is not going to work for Riley and is not going to work for Miyabe. But the thing I've learned through all the research I've done is that there are similarities. If we talk about chronic pain or we talk about lung conditions, we can see people that are using cannabis for certain medical conditions and find some similarities. And that's the stuff that we need to be understanding and knowing about. And that's one of the beautiful things that you guys are doing with NAP. And we're very honored to be a sponsor of NAP and privileged to get the opportunity to work and help you guys any way that we can, and that we get to learn from you. Because I was at After Hours the other day, and I have to tell you, the way you talk about cannabis and the way that you introduce it is so new, and it's so inviting and allowing people to come in. And that's the thing that I want people to understand, is that this is complicated. Don't get me wrong. This is a complicated system, but to understand it and having someone that can talk to you in simple terms is so important. So if you're not following Miyabe and Riley and everything that they do, I say go sign up now, because they can talk to you in a way, because y'all dropped something the other day that is like, why hasn't anybody ever said that? I know this, but you said that your ECS has to live for you to live. You have to have your ECS. And so that's going to lead me to my next question, because I'm always asked this: if my ECS is so important, why don't I know about it? And why isn't my doctor telling me about it?
The answer to that question is like, I feel like I almost have to laugh at it because it's just kind of sad otherwise. But the real answer to that question is just that it was discovered later. I think a component, there's several components of it. There's a political, social component of it, and we don't have the time to go into the background of that part. The scientific side, which is our side, comes from the ECS being discovered later, and comes from it being a more complicated system to study, specifically at our level. Because what we're looking at is, like, if you zoom all the way into the atomic level, when we do like our level of research, it's very difficult to work with fats. And that is a component of why we discovered it later, and why it's difficult to study, and why it has been difficult to study. And because it came around later, a piece of that has to do with it not gaining the same level of importance as when the medical system was first coming around and all this education got started. Everyone was so stuck on the idea that serotonin and dopamine and opioid system and glycine and GABA, that they're the ones that do everything. All of that was kind of established as dogma before we discovered the ECS. And then when we did discover the ECS and started looking more into it, it's like, wow, this really controls all of those other things. And I'm going to say something that I don't mean to be insulting, but it's that medical doctors aren't always taught, or don't always have like the strongest understanding of things that are cutting edge research sort of areas of interest, because that's not how they're taught. That's not what they're trained to do. And until we change the way that we educate medical professionals, which still hasn't happened, although I think nursing is making the biggest strides towards that, until we begin to change that, then, you know, people haven't actually been taught about it. So that's why you don't know about it. And that's why we didn't know about it until we gained the tools and the knowledge to find it out ourselves.
Yeah, so medical professionals are not taught about the ECS when they're in school, or if they are taught, I think we looked in, Miyabe and I were recording a podcast with someone, and they actually pulled out their medical textbook and read the section on cannabis, and it essentially just said like very addicting and like two negative things about it, like two sentences. Psychosis and addicting or something like that. And it was just like, that's all their entire medical textbook said on cannabis, and didn't mention the endocannabinoid system, and didn't mention that this is like a therapeutic target for so many conditions. If we just understood the system, it is the master regulator in the body. And because most medical professionals, they're taught what they're taught in school, and then they practice, right? As Miyabe's saying, they're not necessarily, their role isn't to stay up to date with research and then implement that. So if we never teach that during medical school, then a lot of physicians won't accept it as the truth, right? So we need to see this information integrated into medical schools so that it's just base knowledge, and then people can actually trust their physician, you know, going to them about their cannabis use, as well as like just understanding their ECS in general. And unfortunately, cannabis is still so stigmatized that a lot of people aren't honest with their physician about their cannabis use. And there's also a lot of physicians out there that are still contributing to that stigma. I've experienced it for sure. So it's an uncomfortable thing when your physician is not paying attention to the science and is instead just kind of propagating this view of cannabis as a negative in people's lives and not thinking about the positive.
Well, and this is something we have to address, and we have to get somebody to start listening to it and paying attention, because there's some serious health conditions that are out there that people are working with and using cannabis for. And we still
and they
need
don't
more
have
doctors.
other options. Yeah, there's no
Right.
other options as well. And that is something that's really, it's morally and ethically something that is frustrating, that, you know, cannabis is effective. Hey, it's effective. It actually works, you know, and that is what, like, that's the holy grail of our level of research for drug discovery. Does it actually
it's safe
work?
And it works. Like, it's like the best drug ever. It's amazing. I will also say, I do think there are some medical professionals doing a really good job out there, and especially the ones who are signing up, because there are some courses available for medical professionals and are taking time out of their day to like actually educate themselves on the ECS and cannabis as a whole. There are definitely some good physicians out there, but we need to see more for sure.
We should start some sort of like, there should be like a flagging system for medical professionals. I would prefer to, you know, see a medical professional that I knew was a safe space for me to be like, yeah, I wake up in the morning and wake and bake every day, every single day. And for them to not immediately jump to the conclusion or look at my medical record and make assumptions, right, about why that would be a thing, or that there wouldn't just be the first thought, which is that, oh, that's like an optimal dose schedule for you and for many other people.
Mm-hmm.
Well, and it also becomes, I had a health issue this past year, and it was some abdominal pain and some things that were going on. And I knew if I told the doctors that I used medical cannabis, they immediately were going to think that I was overusing. It was causing the problems, and ended up I had a kidney stone that had to be surgically removed. I felt my own stigma through that, and I haven't felt stigma in a long time, because I'm very open about it. There are still times, even when you're working with a medical professional, you need to know when you can say that and when you can't, because it could actually put you at risk of not getting the attention that you need.
Anesthesia is a big one. Yeah.
This is why we have to have these conversations. I've been doing this for 8 years, and I still learn something every single day.
There's still so much to learn that's coming out, like, you know, recent papers that came out, like, you know, last week, having just huge impact in how we understand it. And I think the internet's really changed that for sure. So I think we're seeing a shift, which is great. I think that it's clear that it's effective for so many of us and that it's safe and that we have all of this information. But there has been an intentional fear mongering and propaganda campaign like for years, multiple, like not, there's been huge pushes at certain times, but then there's also just been the, you know, the support of that is sort of everywhere. And we're still in that. I mean, even saying that we're recommending it to be descheduled, but it still hasn't got, it's like even that, right? Being complicated to be like, oh, is there a medical value here? It's like, what? Like,
it's so ridiculous that it took, like, we have 2 FDA approved drugs from cannabis. Like, it's absolutely bananas when you look into the details of it being a Schedule 1 drug. And like, if you really look into that, you'll understand how messed up that is, that it still is technically a Schedule 1 drug. As Miyabe's saying, like, they announced, they're like, hey, we might do something about this, and everyone's like, yo, let's go, we all celebrate, but like, they haven't actually done anything yet. Like, this is still, we're still just hoping for this and expecting them to do it, but like, they clearly aren't listening to the science. I mean, why?
Right.
We have thousands of publications about cannabis and its safety, how it interacts with the body, you know, exactly how it works, but you know, it's still a Schedule 1 substance.
There's so much unknown in the other components too. And I think that is the part Riley and I have always like really embraced, that side of the unknown, and not, I mean, there's parts of the unknown to fear for sure, but within our field, and like one of the things that allows us to be research partners is that we don't necessarily shy away from the unknown having benefit as well as having detriment, that there are risks and rewards, and that there's clearly unknown reward in the molecular mechanism, in even just how we have a limited understanding of this. So I mean, there's clearly a reward there in the unknown that we're still needing to study, and that until we can study it, we shouldn't be putting it off though, because it's real. We shouldn't need every piece of that unknown to fall into place, because that's unrealistic. It's not true of anything. There's always going to be unknown.
Well, thinking about that is, you know, I'm sitting here and I've been doing this for 8 years. I have been dealing with medical conditions my whole life, and it's been based off of pharmaceuticals and what we do. I personally, using cannabis and how I've had to engage with my ECS and use it, I don't know that traditional research is going to ever find the answers that I'm looking for in understanding how my health is improving. Is that something that's a fair statement?
It's not designed to. It's not designed to look at something at this level of complexity. And especially, I mean, cannabis also has like a spiritual aspect. It has a traditional aspect. There's a lot of beauty, I think, in having the option to grow your own medicine, choose what variety or chemical profile is interacting with your body, you know, be part of that whole process, and then actually like enjoy the process, enjoy it with your friends, open your minds together, increase your health. Like, there's so many benefits to it that we just have never studied to that depth. So I don't think we can fully understand it, and I'm not sure we're meant to either. But this is also back to that faith in the unknown thing, where it's like, maybe some aspects of medicine we won't fully understand, but at least from like a pharmacological perspective, I think eventually we could have the tools to understand at least big picture things going on in a relatively complex way.
Okay, I'll make it. So we once saw a presentation together, and I always get a little bit defensive and sad, honestly, when all the information always comes up about it being like, cannabis is decreasing your brain activity here, and it's decreasing this. And, you know, right when we get out of that conversation, Riley looks over at me and goes, yeah, like, it's decreasing these things that we're measuring, but that energy could easily be increasing things elsewhere, like creativity.
Where's it going? Like energy is not created and destroyed. It's moved, right? So if it does decrease a certain part of your brain, maybe we're just not monitoring the place that it's increasing. And maybe that's creativity and positivity and, you know, so many other aspects.
And that the decrease is not a net benefit is like, well, you clearly have never been inside my brain when it's at its top speed, because I don't ever really want to go back to what it was like before I ever used cannabis ever. And I've gone like a year almost a year without using cannabis and like redocumenting everything. And the net benefit that can come from what some people would look at and conceive as a decrease, and like what you're describing, and when Riley said the system isn't designed to evaluate that, it really is just the way that we have been looking at even just like our lives and our regulation, individually versus as a whole versus on average, and assessment of net benefit and net risk that comes into it. And I think it's possible, and we are definitely seeing so much new research coming out, and it's really exciting. But I think we're so far ever from being able to understand fully what we understand in our bodies, conceptually start to understand when we start to form a relationship with this plant, when we see it and understand what does and doesn't work for us, what times, and the internal tells, right, of being like, oh, I should smoke a little more today, or oh no, like that was actually good for me today. A lot of that has to do with like self-awareness, meta-analysis, because it also changes every day just from ourselves.
That was the most freeing part to me in learning how to use cannabis and engaging my ECS, is knowing that I had the ability to decide based on what my system's telling me on when I need to medicate, because it's traditionally trained in medicine. You go by, this is the formula, this is what you do. You can only do it, let's say, every 12 hours. You can't do it an hour early, an hour late. It's 12 hours if you really follow the rules. And that was the most liberating thing, is understanding that I get to be in control of when I need to medicate, so that I can make sure that my health is functioning the very best that it can be. I medicate from sun up to sundown, just like you do, Miyabe, but I have to. That's what my body needs. I'm hoping over time it gets more regulated. I'm finding that my pain is. I used to live in a pain of 10, and I can now actually tell you, I don't even think about my pain anymore, which is truly amazing. If I hit my leg or do something like that, I do. But it took me a long time to even want to say that, because I'm so afraid of losing that. I'm so afraid of it not always being true, because living in a pain of 10 for over 3 decades is not a place anybody should live. So understanding that this medicine can make those kind of changes if you get in a relationship with it, is what I call it. You need to have a relationship with this plant and understand how it works for you, not how it works for someone else. So I appreciate you saying that.
I mean, our bodies are so dynamic. They're changing all the time based on when we eat and our hormone levels and the sun and like so many different factors, right? And it is pretty insane to think that our medicine should be so constant when our bodies are so dynamic. Like if we did have the ability to change other medications in that way, you'd wonder if it would change the efficacy of these other medicines as well, because they are affecting these systems in our body that are always changing. They're dynamic. So that's just, I wonder about that.
I definitely wonder about that, because being someone that was on 240 milligrams a day of OxyContin, let's just think about that for a moment. That's insane.
Yeah.
And
For
I
your
was still in a
GI
pain
system.
of 10.
Yeah, and then also for the other parts that it interacts with, not just your pain. Like
Right.
there's
Yeah.
Oh yeah, it impacted everything about me and changed who I was as a person. And I still wasn't getting the relief. So understanding that some medicine can come in and actually free me from all of that. And now I don't take that at all. I've eliminated 28 pharmaceuticals just by using cannabis and understanding how I have a relationship with it. But this is why the science is so important, because everybody's looking for the science to answer the questions of all of this that we're talking about here. And so, this is going to lead me to my next question.
Well, can I just add, Debbie, that
Sure.
like part of what we do for NAP is we're trying to design scientific studies to use as advocacy. So like using science as advocacy, because, a lot of the data we're collecting, it seems pretty obvious, but it's never been collected before, especially on stoners or daily cannabis users or high needs medical patients, whatever you want to call us. We are a population of people that is very sensitive population, and we have not been studied, especially in the medical context, and understanding it from a positive or neutral perspective, or at least not a negative perspective. So like the data we're working on publishing soon is from our first longitudinal study. And we are publishing data on like the percent of people who drive while using cannabis, how many times people are medicating per day, you know, like all of this information just on daily cannabis use that as a community, we know because we are us, but to the general world, like it's not necessarily something that's published on or known or just represented in literature at all. So we want to contribute that so people know that it's not absurd to wake and bake. A lot of people, the majority of people who are daily cannabis users are also doing that. And, you know, it's okay. And it's making people feel kind of liberated and part of a community, but also a communication tool to talk to their parents, their friends, their doctors, you know, whatever it is, and just say like, I'm not alone here. And like, I'm part of this population of people that responds really well to cannabis. And, you know, being able to use that in either political or personal standpoints, we think is incredibly valuable. And I wish I had that information growing up to, you know, help represent myself and my brain.
I would give anything to have had that information growing up. I grew up through the 60s, so you've got to get a kind of an idea of where I grew up and what the knowledge and what I was being taught. But the thing I can sit here and tell you now, if I had access to cannabis and knew what I knew now, I know for a fact I would not have lived the life that I lived, and that I would actually be able to have a different life. What that would look like, I can't tell you because I can't go back. But
Right.
what I've been able to accomplish, I know that much, that I would not have lived the life that I lived 3 decades. So this brings me to understanding, are there age-related changes in our endocannabinoid system that impact how we respond to cannabis? And is there a test that we will ever get that we might be able to test to see if there's an imbalance?
The test one, I think there has to be so much more that's going to have to be done before we see that, because like we mentioned, like doctors don't even have like most of them don't have knowledge about it, and likely that would be through there. Even if there was a private test that we'd be able to give, like say just to buy, like going to Quest Diagnostic or going to another diagnostic testing facility, I don't know that we would know what to look for, where to look, or what any average yet is. Like there's pretty known like changes, there's like papers that have been published about changes that happen throughout age, but typically also there's a lot of animal model stuff that's not exactly representative of our lives change, especially those of us who go through like hormonal changes and fluctuations, first of all monthly for a huge portion of our lives, but then like other huge changes like pregnancy, right? Something else that should be studied. But menopause, another example. And then just, you know, there's tons of other age-related changes that are just on this giant scale. So like, I think absolutely, I think we can say without a doubt that everything changes as we're aging. And that like we had some interesting information from one of our data sets at a Boston show, at our Boston data collection exhibit. And that was that there were different, in general, there was like age specific preference for aroma profiles of cannabis, or there were trends that you could see. And, you know, that was very interesting. Like, you know, what is that from? Is that an aroma preference because of effects or because of changes in perception? Is it because of how much cannabis has changed in, you know, the last like 50, 100 years? Cannabis itself has evolved like crazy. But I think it's without a doubt that we can say that there are changes. I think that we're still a really far away place from understanding like what those mean at a community level, at an individual level, and then to be able to get a test. I would love to be able to get a test on all parts of my brain, but it's probably quite invasive. And I've told people I'm available, but so far no takers.
Yeah, to Miyabe's point too, it's like, okay, you collect that data and then what? Like, what are we comparing that to? So I think if we did have a test like that, you'd have to measure your own data over time and then be able to test when something's dysregulated according to yourself. And maybe there's certain biomarkers or certain proteins that might be able to tell you like if you're going to be able to feel edibles or if you can metabolize things in a normal way. But I think it'd be very difficult to be like, oh, at this moment you need 20 milligrams of CBG, and like I think we're a really far away from that. But to some technology, I think we could see something in the next decade that's relatively helpful.
And I think this is why we're having this conversation, is because people want to have that test. People
Yeah.
want to go into the
Yes.
lab and get a test to say, oh, this is what's wrong with me and this is going to fix it. And that's the reason
Yes.
we're having this conversation, is because it's not that simple. And
Yeah, it's
that
not
easy.
really. Yeah, it's not really that anything necessarily is wrong either. Sometimes it's like there's this concept that, I mean, yes, there could be dysregulations, and there's definitely traits, symptoms, issues, and challenges that make life really, really difficult. And that searching for like a cure and like using that type of terminology when talking about cannabis and when talking about any drug for that matter, I feel like both of us kind of feel a little more along the lines of like, no, like life is going to always, different lives, every life has unique challenges and unique situations, and that this is about finding your quality of life. This is about finding a flexibility in a lifestyle, and not just for both of us, it's not just cannabis, right? So that's also a huge component of understanding like how we're even approaching being able to get that information, because I still just doubt that a test would replace like the trial and error that we know inherently, or that we come to as you do start to understand more about cannabis as a plant, and you do experiment more and you understand yourself more. I don't know yet that you would be able to have that same like intuition, because like Riley said earlier, there's all these components of it for many of us who are deeply in love with cannabis because of our relationship with it as a medicine, that there's components of that are not necessarily ever going to be represented by like a sheet of paper that says go for like a tropical citrus aroma profile, or go for something with this split of CBD and THC. And yeah, and that I think we're definitely going to get more interesting tests and more information, and since we're both data nerds, we're like, yeah, all the tests, bring them on. But in terms of that being conclusive, I still feel like the lived experience, which is why we focus so heavily on collecting real information from the real world, is that there's all these different variables and obligations in our lives. And it is even going back to talking about the aging. I have a lot of people who tell me like, wow, like I have so much more anxiety now using cannabis. I never used to have that. And a huge component of this is also the demands and needs of our life changing, and the anxiety and responsibilities generally climbs as we age, or there's fluctuations for sure, depending
Or
on.
maybe you don't need cannabis at that time, and that's your body saying, yo, we're good right now, like we're balanced. And that can be hard to listen to too, because we do have a spiritual connection with the plant. And I do think that's where like the different varieties come in handy. It's like sometimes you don't always need THC to have a lot of these amazing effects from cannabis, and really exploring CBG weed and CBD weed, and understanding that you can use that to mix with THC or to have alone is like also a very special experience. And it does have unique effects compared to like taking a tincture of the same product. But I do think part of that anxiety, like if your body's telling you to take a break from THC, it's okay to take a break from THC. And if you need something to replace that with, for instance, if you did have a chronic pain issue, this is where something like CBG comes in handy. You can still get that relief from the pain, but you can also, not have that anxiety that's ruining your experience and changing your relationship.
Topicals are options. That there's so many different varieties. Like right now I'm in a pretty high anxiety state and have been for a little bit, which means that I've always been balancing for the most part with CBD. And what that could mean for me is waking up in the morning and taking CBD first thing in the morning, and then it's in my system in a high amount, and then I don't like think about mixing my flower ratios as much or something like that. But that there's different times, and that self-awareness and that sort of like autonomy and self-determination of our medicine, it's something that's really, really special about cannabis. It's relationships that we can have with all sorts of plant, like all sorts of things in our life once we like are more aware of it, like even socialization. What is our relationship with being around people? Are we doing it out of obligation, or are we doing it because it's like something that's beneficial and helpful? Like we could just keep going deeper and deeper and deeper. Cannabis is just one little way that we could shine light to, for some of us life is incredibly difficult, that it's preventative to use cannabis. It's not always going to be the same, and given the information that we know now, I really do feel that the way forward for all of us is, and that helps all of us, is for us to harness what we have in the real world evidence and then talk about it, because we're similar to each other, but we're also different enough for each other. It's more like we give each other a starting point than it is to just give someone a piece of paper at the finish line. Like, and that's sort of just a difference in the medical approach to how you're going to help someone, right? Like,
what other situation do we have this many people already taking a substance that we need to study? Like, we're already to human trials, and like, let's just study it more. I mean, people are already doing it. So all we need to do is probe the population and understand the different products on the market, which is something I think is crazy about research, that right now we cannot research, like with government funded money, any products that are available in dispensaries. Like, we're not allowed to. So it's like the most relevant products in the world are the ones we are not allowed to study for research purposes,
with new formulations, like new processes and like new innovations. Like, you know, our structure for research that we've been using to research and to do this level of research, which is really expensive and requires, it's expensive and it requires a ton of time, effort, energy. Like, it is not something to be done on the side. You really have to be immersed in like, you know, taking care of the machines and doing your sample prep and teaching students to help, you know, keep up with this research, and new research comes out every day. And, you know, we are not able to access that yet. Right now, it's not able to be done. And so, you know, we are the experience because we are the ones, and by us sharing what these experiences are, that is the data right now. And we're really hoping to try to not just like harness and get that data information, present it back to the public, but also just like interpret it in a way that is not only through the mindset of it being negative, you know, not only through looking at this as an issue or as a risk, because there's risk to reward to everything. And it's absolutely insane. And that is something that would change if cannabis had medical value. Geez. It's like,
well, and I'm going to say right now, it has medical value. We need to start saying that it has medical value.
Right. In the eyes of the federal government.
In the eyes of well, they have a patent on it. So, you know, they must believe there's something good about it. We do need
I think there's too many good things about it. That's why we're in the situation that we're in.
That's 100%.
Yeah. Well, and we're not going to go down this whole rabbit hole, but I will tell you, being raised in the 60s and understanding how we were taught, it really is a disservice to us as a human race, because cannabis does have the ability to change your quality of life and your quality of health. And why are we not doing this? And I think I shared this with you before, but, you know, if we just take one health condition and look at the benefits that people are making out of it, we'll take cancer and look at how many people are making benefits with using cannabis to treat their cancer. Who doesn't want to have good success with that when they get diagnosed with cancer? So why are we not talking about this? I mean, I don't think I have ever met a soul that doesn't know someone that has cancer. And if you walk into a cancer clinic, it's just full of people with walkers and older individuals that are trying to get help. Can't we be a little kinder, give them something a little bit calmer, something that provides? I'm not saying it cures it. I'm just saying we have enough research now to know that it is a helpful tool when you have cancer.
Well, on a fundamental level, the role of your ECS, your endocannabinoid system, is to bring balance to dysregulated systems, right? And cancer is, like, by definition, cells with dysregulated systems. They're not operating correctly, and they're replicating in a way that they shouldn't. So I do believe that activation of your ECS or manipulation of it is integrated into literally every disease and every pathology, because it's a result of a dysregulated system. And like, that is why cannabis is good for so many things. It's because despite what you have going on in your body, cannabis can help bring balance and bring regulation back there, bringing it back to a healthy state. So I think cancer is a really, really good example of this. But there's so many other great examples too, because that literally is the definition of disease.
Right, but if we just took one and could cure all those people or help them or prevent them, I believe it could actually be a preventative tool. I
It's
believe if
definitely
it can kill
preventative.
cancer or deal with those cells that don't belong there, can it prevent them?
I think that it absolutely can, and I think that the issue is that like there's all these variables with like not just genetic variables but environmental variables, right? Like I have never lived places where the air quality is great. I've lived in urban spaces for most of my life. You cannot not take that into account, that I don't live on like a major street, or that I haven't always, but there's, and then like, you know, diet is another huge component of this. And I think looking at them in isolation is almost like it almost just doesn't make sense to look at the whole and just be like, you know, it's not just, yeah, it's not just cancer, and it's not just chronic pain, it's not just TBI, it's not just PTSD, it's not just all of these separate like seizure disorders. Like for both of us, it's like, could we separate what we would have been without cannabis, considering we started using cannabis quite young, and that, as Riley, you put up, it shapes our lives both directions, like in both ways. And are you ever going to be able to quantify what would have happened? No, because there's all this. I'm going to go to the psychosis topic, and I'm going to also caveat it with, I'm not a medical professional. This opinion is not shared by medical professionals, and this is just an opinion on the scientific literature that's out there thus far, is that I'm not convinced that cannabis causes psychosis. I'm convinced that there's a correlation that absolutely exists. But how many people are out there like me, for example, that we don't know what their trajectory would have been like without cannabis, and that you'll never be able to identify that? Yes, like that, not that you'll never be able to identify it, but you can't prove what would have happened to me without cannabis. There's, you know, that aspect of the unknown. And I think that's what we're, you know, to be searching for. Hey, we want to know that it's like cannabis always is helpful in this way. No, we can't say that for always, for anything. But what we already know without a doubt is that it's helpful for a huge number of things in a better and more efficacious way with better safety profile than any alternative, and that it integrates within life in such a way that, like, typically there's other changes too, right? Like typically it is replacing pharmaceuticals or alcohol, and it
I think that's the
like
big thing, especially with teen use, which always comes up. And I mean, we were all there at one point in our life, right? Because we look at the data and it's like, okay, cannabis is bad for teen brains. And it's like, is it though? Because if I wasn't smoking weed, I would have been doing something. I wasn't going to be sitting at home reading a book. So like the question we never answer is the, or what? Like compared to what? Compared to the unknown that we don't know what would happen. But we also know that cannabis is used as a harm reduction mechanism all the time, because it really does put your body at ease, and you're able to at least accept the fact that you're not doing the other things, especially for people who were addicted to much more harmful substances. So I think that's another thing that we need to look for in, like, when we're reading research papers, to have kind of the context of, how does this relate to like a human being and like the experiences a human being would have? Because life is not so black and white that we see in research. There's a lot of complexities that are really hard to quantify. But let's just remember ourselves when we were a teen. And, you know, at least for me, I think of myself, and I'm very, very happy that I had cannabis and that my parents were accepting of cannabis. I think that really changed a lot of aspects of my life.
There weren't too many people in my life growing up that were accepting of it at my age, for sure. And exploring that was not an option for me because I was too afraid of what would happen. But
it's
the thing
it's
that
better
I
to
find,
have medical. It's better to have the medical lens, though, right? And all of us kind of lacked that because there wasn't information about the medical lens being put out. And still, even now, the information about the medical lens is being put out with giant red warning things being like, oh, it has medical benefit, but it might cause cardiac issues. And oh, it has medical benefit, but there's an addiction potential. And it's like sugar, the biggest addiction potential out of anything. And
I agree with you for sure. You know, we have to
hard.
take everything in context. And, you know, to follow up on that, I think about when we talk about kids and medical conditions that we know that we're using cannabis for, epilepsy. I think that any kid that has to live with seizures, especially 500 a day, that's unacceptable. And I think that's making a child live in a world of chaos that maybe they don't have to. I'm not saying that it will fix or help everybody that has seizures, but we give them pharmaceuticals every day not understanding what that's impacting them and how. And we may never know because they can't articulate, they can't talk to us a lot of times and tell us what they feel because we start them on them at such a young age.
And that those are hepatotoxic and that they cause their own issues after time. And that's the part that gets really complicated, is that whenever we look at these studies and we're saying things like, okay, cannabis increases your risk, or we're worried about Epidiolex, and that there's a whole other thing because they use isolate. So that's controversial as well, because we can increase the efficiency with THC, at least within the community. It is known that full spectrum products, things that contain, it might not even just be the THC, you know, we still don't understand everything that goes into that. And yeah, there is just so much unknown that is still there. And where the ethical moral thing for both Riley and I, having studied drug discovery especially, is that like we represent two halves of the very first beginning parts of drug discovery. Like, how do you discover a new drug? How do you design and get a new drug to pass the FDA? And what is a blockbuster drug? And what does that mean? And, you know, Riley's half of it is studying the natural world, because that is the source of the magic for the molecules, for a ton of it. And then my side of it is looking at how that interacts with our systems and what it makes. And when you look at that and you break that down from a drug discovery standpoint for cannabis, there's absolutely no question. And I know that it's a controversial take on it for kids and for teens, but we put kids and teens on other medications all the time. I was 19 when I was prescribed my first psychiatric medication. I was a
birth
teen.
control, Adderall,
Oh my
and
God.
then we
Birth
have
control.
these kids on these drugs for the next 2 decades, and we think there's going to be no adverse effects. I mean, let's be real. That doesn't make any sense at all. Like, we need to be thinking about not just cannabis, but like we need to be thinking about other drugs that we're giving children with the same scrutiny that we're looking at cannabis, because I don't think we'd be giving them any of these substances, and probably a lot more cannabis, if we looked under an objective lens at all of these different substances.
Well, I'm going to take us back to cancer in kids, because I worked in the cancer field and we had many children that had cancer, and families were, whatever you can do, help me. Let's get them started. I want my child as long as I can have them. What parent doesn't want that?
Right.
And so they never stop and ask, what are the risks? What can happen? And we didn't really know until like 20 years later what the impact of those chemotherapies and radiation treatments were on kids. And so, you know, it's really important that we understand that, you know, cannabis could actually be a helping tool and helping your child live a more happy and joyful life. It's just that in itself. If we just look at cannabis for that, that's huge. Because, you know, I haven't met a kid yet that has cancers that's not a happy little lucky go guy or girl, but actually, you know, giving them something that could actually uplift them even more, make them feel happy, make them enjoy that day, because that's the day they have, is today. We don't know that they're going to have tomorrow. Let's think about today. So, I mean, if we just look at it and from those viewpoints, you know, we rush to these pharmaceuticals, and yes, they serve a purpose. Don't get me wrong. I'm not saying that. But we also need to understand that there's another tool in your toolkit.
There's a lot of contradictions and hypocrisy in the way that we are approaching just the word medicine. And if we encompass medicine with natural products and pharmaceuticals, that there's going to be this contradiction and hypocrisy there. And that a component of it, and what you're saying about focusing on the now and focusing on quality of life and focusing on the present, you know, that is another component that, you know, we've been removed from in some of our ways that we've looked at medicine, and the way that we've sort of offset that responsibility, because it's a big responsibility to take your health into your own hands. It's a lot of time, effort, research, work, and we've definitely removed ourselves from that process and sort of entrusted it within a system. And it turns out that that system is very profitable, although not for everyone. And that, you know, there's a dynamic there that is influencing the decisions that are made for everyone, that have been removed from then, like, what is the experience of life though for individuals? And I think it's without a doubt that that's when we're talking about cannabis science, that we're talking about looking at where the source or the seed of that system is. And because, you know, science informs medicine in many ways, and science is used all the time, for purposes of extrapolation and, you know, fear and control.
Well, in general, people don't think about their health as an asset. Your health is your number one asset to you living your absolute best life. Regardless of how quality of health you have, the better your health is, the better life you'll have. That's just a fact. And so when do we start teaching that? We don't start teaching you anything about that in general till you're sick. And then we don't really teach it. We just start providing you with some recommendations, go here, do that. I think this is something that should be being taught from very early on. We teach our kids to tie their shoes. We teach our kids to talk. We teach our kids to walk, to read. Can we not teach them the value of their health and how important of an asset that is? I believe we can.
So
and
that's
I
what
think
should be like, that should be taught in health class, right?
Yes.
And we should also like learn, Miyabe and I talk about this all the time, for high schoolers specifically, if we could teach the systems in the body in the perspective of how substances work in the body, people would understand how drugs work a lot better and be much more careful with certain substances, but also understand how medicine works and how these different systems in our body are interconnected and how certain medicines affect certain receptors. And we think kids would be much more interested in science and in their own body if we taught it from a perspective that was interesting to them and something that they already wanted more information on. But we're just scared to say this to kids because we think it's going to make them want to do more drugs, when in reality, we have no correlation there. And education is the best form of harm reduction. So this is how we should be educating the super vulnerable population of kids who are just like yearning for more information on this stuff.
There's a bunch of studies that show that increasing access to cannabis doesn't increase youth consumption. So those of us that are experimenting with cannabis, like, not saying it's going to be predetermined, but like, I know exactly what the drive was there for experimentation just in general, right? And the experimentation was absolutely going to happen and was absolutely going to like escalate into other things. I'm lucky about cannabis. I feel lucky about cannabis.
Well, from all the trauma work I've done, everybody's looking for help for something. They're in search of something to feel better. And that's where I land on this, is that, you know, if they're looking for something to feel better, maybe we should understand this so that we can approach this and help them understand when they're in their youth, how can you feel better? What can you do? What are the things you can do? And this doesn't just mean cannabis. This means diet, exercise, water intake, everything that you can think of. But it's like, we don't teach that. And it isn't until you get sick that you start realizing, oh, I have an issue, or you've been exposed to it a lot, but we still don't have these conversations. And I think they're really important. And I think that this should be taught in every school that's out there.
We really think it should be taught. High school age is like late. I feel like that's late in the game, but I mean, we're not teaching it at all. So that's also, I like these questions. These are all really fun. They're all the questions that, they're the questions that like the answers to them are like, yeah, it's all about how we've been thinking or like trained to be thinking about this.
Well, I think that these are things that people are curious about. That, you know, it's important that we start having these conversations. I want this conversation happening at every dinner table or wherever you consume your meals. I think we should all be talking about this.
That's how it's going to happen too, is that's something that we both feel like with NAP is trying to break this down, make the research accessible, make people involved in the research and understanding more about the process. Then you are more confident to have these conversations because you do understand the limitations of the research that you're talking about. Like, that's where I think a lot of the difficulty comes in, you know, being uncomfortable talking about a subject that is stigmatized, a subject that you are going to be defending yourself in a way. Being able to understand the full context or the full picture of all of it is really, you know, we're not going to be in every table, but the point is to empower other people to be at the table with us and then bring that to their communities and to their tables.
So let's wrap up with talking about NAP real quick for just a few minutes, if you don't mind. One of my favorite subjects, what you guys are working on.
And it has been a wild ride. So NAP is short for the Network of Applied Pharmacognosy, which Riley explained earlier, is because first of all, we want to approach cannabis from the natural medicines like side, and then network component of it being that there's a network of molecules inside the plants, there's a network between living things, and then there's a network between us and between everyone who's doing research in academia, in the industry, and then most importantly, the community, those of us who are using the medicine. And that this is an independent research nonprofit. It's outside of, you know, a specific industrial goal, like a private company. Like, we don't have a product that we're doing this research to, you know, benefit. Not saying that there's anything wrong with that, but just saying that that has a different influence on the research. And we're outside of academia, which receives its funding from the federal government, and so it has biases there. And we're working to partner as a network with both academic researchers and industry researchers and the community, and by being transparent about what we're doing, you know, to create this new environment for learning and new opportunities for accessibility of science. And as Riley mentioned, science advocacy, how to use science to help all of us, to help us explain ourselves, to help us explain ourselves to medical professionals, to also help the scientific community come around to understand what it is even missing or lacking, because most scientists aren't out here trying to be ignorant. You know, science wants to be relevant, but it's just really difficult if you're not part of our community. You know, you don't have that, all of that knowledge that ends up getting built over years and years and years. So we're really, really excited, and it's been wild in the first year, but we have some big collaborations, and actually one that we were mentioning about smoking and about evaluating, you know, smoking is a medical method of delivery. It is the most popular method specifically for people who consume large doses and dose multiple times per day. And it has never been studied in the context of how to improve upon that methodology. Instead of just saying, like, let's replace it entirely, it's like, sure, that can be the goal, but there also could be research done on improving the smoke quality, on understanding the smoke quality. And it's an example of some of the collaborations that we're doing to help bring science to a relevant and tangible outcome and do it immediately, so that we can disclose this information and be talking to people about it, you know, while we're actually still doing the research, while we're still planning the research.
We want to do the science of vapeability next, which I think would be really cool. If we can get the sponsors to do it, we'll 100 billion% do it. But it would be really interesting to compare all these different factors in smoking and cultivation, and then take that same variety in cultivation and then do a bunch of dry herb vape experiments, and then extract it in different ways, and then, you know, combust the extract or vape the extract, and just really start to understand with the same starting material what is happening through all of these different processes. Because unfortunately, a lot of our knowledge also comes from marketing certain products, and, you know, a lot of that is accurate, but at the same time, companies are, one, only going to publish what benefits them and their company, right? And, you know, two, might not always be just the most applicable to our everyday lives. So I think it's really important that, like, we're kind of like third-party scientists doing this work, and we're not working for a specific company, we're not working for a specific product, we're working for the community. So I think we get to look at science in kind of a different lens. And as Miyabe's saying, like, as consumers, this data means a lot to us and our family and our friends and our community as well. So we are personally tied to it, which is pretty different, because a lot of academic labs or people who are studying cannabis unfortunately don't really consume the plant. And I don't want to be a hater, but you can tell in, like, the first paragraph of an introduction of a paper, you're like, oh, okay, they don't use cannabis. But there's so many things that aren't published on within the industry that we know from experience as consumers, or even just having these conversations with people in the industry and having this bond of trust, that we've learned so much that, you know, we're really shaping the research we do around the information that we get through so many different ways, whether it's peer-reviewed research or if it's peer-reviewed conversations around a joint. You know, it's still super valuable. So I think that's kind of the unique perspective that we bring into the research realm.
Well, thank you both for being here. I appreciate you so much. And we will have all the information about NAP in the write-up below, that you can sign up for the study. You can donate to the study. They're always looking for money to help move this forward. It takes all of us. If we're going to move cannabis forward, it takes all of us. This is a collaborative project in my mind, everybody that's working in cannabis, we should be working together, supporting one another and making sure that we're moving this conversation forward, because this matters today, tomorrow, and for generations to come.
Thanks for having us on, Debbie. It's been great talking to you.
Thanks so much. And thanks for sponsoring. Thanks for being a sponsor, one of the first sponsors of NAP, because we agree and we're all going to ride this together. And we're finding out who is and isn't supportive, like within academia and the industry. There's good people and bad people and all sorts of people. I shouldn't say good and bad, but there are people who care and people who don't care in every realm of every population. In any way we're going to cut any situation. And we have been really fortunate to have been supported, like members of organizations like yourselves who do care. And it's becoming clear there are people who care about the research, there are people who care about the community, and there are people who are there for the dollar sign. And we were always going to be that way, and we're finding all the right people. And that's been a really cool part of this journey too.
We so appreciate you dropping in. Your time and support are invaluable as we strive to educate and advocate for the transformative potential of medical cannabis. Remember, you have only one health and one life, and no one lives them but you. Let's continue this journey together. Subscribe and hit the bell icon to stay updated on our latest conversations. Your comments and engagement fuel the dialogue we need to create change. Until next time, stay empowered and keep exploring the wonders of your endocannabinoid system.